So we're Jamie and Julian Stocks, and Jamie's been a patient for a little bit longer, and I started coming in because I have trigeminal neuralgia, and then it happened that we took care of some other issues too. Trigeminal neuralgia, I was diagnosed in 2010, and every time there was a flare up, there was no real prediction. It just happened. They would just take me out of commission for 24 to 36 hours. They gave me pain medication for it. So I would go to a dark room, lay down, take the medicine, and be knocked unconscious. I'm sensitive to drug medications. I don't like to take them. They tend to really affect me strongly. It would be really bad. I would swell, my face would lag, and the pain would just be very intense. Did meet with one specialist who talked to me about surgery. I didn't like the idea of it. They cut the nerve, they sever that trigeminal nerve. I had one doctor tell me that he thought it was ear problems and headache problems, and that I was just kind of being dramatic, and that wasn't the case.
Well, it's not like she had these constantly, but like you said, when she did get those, it just put her down. And so I was mentioning it to the doc, and he says, you know what, I've had some success with patients in the past, and so let's see if we just bring her in. Let's just take a look. She was up for the invitation and came in and went through it.
I'd say it was about 3 or 4 visits in, so probably within a month, that I stopped and said, I've not even had any of the tingles, little flares where the pain would shoot. And I realized I hadn't even experienced that the entire time. So then I started really paying attention, and I've had no issues with my trigeminal neuralgia since we started our treatment,
Right.
which makes me very happy. So I talked to him one time about the fact that I had suffered from acid reflux for years. I had become accustomed to sitting straight and just let my head fall sideways to sleep at night because it was so severe. And he said, we can work on that too. So we talked a little bit about that, and he added that to the treatment with me. It took me 3 days to get completely off of all medications that I was taking for that. And I was on prescriptions for it, as well as eating Tums and Rolaids just nonstop, trying to keep it under control.
That's what I like about coming and explaining things to the doc. He educates on what he's doing, why he's doing it, what the diagnosis is, what's causing this, and then what we're going to do to fix this. If you tried this and if something's not as effective, well, let's change it a little bit. And
right.
But he did give us some samples. Here, try these, before you go out and buy these on your own.
Right. It gives you information of things that you can take to do on your own at home to continue being healthier, to continue with what he's doing for you. So that we have our chores at home that we go along with it. So it helps. I have more mobility. I definitely can move around and do a few more things. That makes me very proud that I can do that, because I couldn't a year ago. I couldn't have done the stairs. It winded me.